An 80-year-old Chinese tourist has become Europe's first coronavirus fatality. The pensioner from Hubei province was taken ill 3 weeks ago while on holiday in France and died yesterday. Here, all but one of the 9 patients in the UK to have tested positive for the virus have been released from hospital. The Health Secretary said it was evidence that the NHS is well prepared to deal with the virus. But a survey of NHS staff by this programme shows that many are concerned about the lack of capacity. Here's Fatima Manji.
The first death from coronavirus in Europe took place at Bichat Hospital in Paris. The patient was an 80-year-old Chinese tourist who developed a serious lung infection due to the virus. He was admitted here some 3 weeks ago after initially being turned away from 2 other hospitals. This is just one of a handful of hospitals in France with special isolation rooms. In China, the World Health Organization has begun an investigation into how the virus is spreading, with a warning that it's impossible to predict which direction the epidemic will take.
For too long, the world has operated on a cycle of panic and neglect. We throw money at an outbreak, and when it's over, we forget about it and do nothing to prevent the next one.
So how will Britain's health system manage? 8 out of 9 people being treated for the virus have now been discharged. The Health Secretary says it's evidence of the NHS being well prepared. But this programme has heard from healthcare workers who are worried.
I think that the NHS is ready for coronavirus. My concerns lie more with the fact that the NHS is already at a tipping point. We know that this illness can be very mild and may not require intensive care facilities, but acute respiratory symptoms might do, and we are familiar with the fact that our ITU departments, our children's ITU departments, are very full indeed, and that is a worry if this were to become a widespread disease in the UK.
Last night in a special programme, we aired concerns expressed in an exclusive survey of over 500 frontline NHS staff. Since then, more health workers have been in touch with us. We've repeatedly heard complaints about NHS 111 giving out wrong advice.
I'm a GP. Lots of reports of 111 triaging calls inappropriately and sending suspected cases to A&E and GPs. Nightmare situation.
And GPs not being prepared or having the right equipment.
We can't get hold of any personal protective equipment gear. It's out of stock everywhere.
While staff in hospitals are telling us they're worried they won't cope.
We have a major lack of critical care isolation rooms. Our hospital is already full.
We don't have the intensive care unit capacity or enough adequate infection control rooms. I can't tell you how worried I am about my elderly, immunosuppressed, diabetic and cancer treatment patients.
Public Health England says advice and updates on coronavirus are being sent to hospitals across the country and that there are extensive plans across the NHS for dealing with the reasonable worst-case scenario.